A very good afternoon. We are coming to you from the Nelson Mandela Academic Hospital here in Mthatha, where the Eastern Cape Premier as well as the Health MEC, Nomakosazana Meth, have just briefed the media on the issue of coronavirus in the province. Well, the Premier has touched on a number of issues. On the issue of coronavirus, he mentioned that the numbers are on the rise in the province and that the Buffalo City and the Nelson Mandela Bay metros are having the highest numbers. He also mentioned or touched on the issue of the death of initiates here in the Eastern Cape, mentioning that there are about 23 initiates who have passed away this season. And we are now joined by the Health MEC, Nomakosazana Meth, who is going to tell us about the coronavirus update in the province. Health MEC, thank you very much, Ma'am Nomakosazana. The Premier said that we have about 2 million people who have vaccinated. And remember earlier, MEC, we had about 20 or rather 50,000 people per day who are vaccinating, and we hear that the number has dropped. Why?
Good afternoon to you and the viewers at home. We've been seeing this decline in terms of the number of people who are coming forward to be vaccinated, and we translated or interpreted it to say there is a fatigue. Hence the VUMA vaccination campaign, which is a national campaign that was launched by the President. But we've tried everything. We are happy to see that there is a closure in terms of the gap, at least between the females and males, because we had experienced hesitance amongst men. It means the message that we've been trying to send across, in particular to the male citizens of our province, is receiving some attention, but still we are not happy with the number. As you are saying, we come from around 50,000, 40,000 per day, now we are at 20,000, but our target still is 40,000 per day if we are to reach our target of 70% coverage by the end of December. So we are worried about that, and we are trying to talk with our leaders, in particular the leadership of the society in general. As you know, we've been working with our partners, the traditional leaders, the church leaders, but now we've got this new cohort of the newly elected mayors, both of districts, metros and local municipalities. We think we need to do some work there to revive the work that is done by the joint operations committees, be it from the metro, district or the local, not just to get the reports or to have meetings that are sitting, but to have joint programs, in particular in taking lead in the issue of doing the program, the campaign on the VUMA vaccination, and also in making the municipalities understand that we are still living in a disaster situation, and in terms of the Disaster Management Act, the districts and metros are charged with the responsibility to lead the response to disaster. So our appeal is for our newly elected leadership in municipalities to join hands, to coordinate and be at the forefront to lead, in particular in the program of ensuring that there is vaccination program that is done. People are coming up in numbers to come and vaccinate. Also in ensuring that our people continue to use the non-pharmaceutical interventions, because as we speak, because of the lockdown levels that were eased a bit to be at level 1, we saw people thinking like the COVID is no more. The reality is that Omicron is amongst us. So we are appealing to our people to say, also as the province of the Eastern Cape, we are not spared of this virus. We are seeing numbers rising, in particular our health workers, doctors and clinicians in general are being infected, and majority of them are seated at home because this one is spreading very fast than the others that we have since experienced in terms of variants.
Okay, and also MEC, the financial constraints as well as resources in the province. Earlier you mentioned that they are also attributing to the drop in the numbers of vaccinated people.
Yes, I can say there is a level of that, but it's not massive. As I said, sometimes we have some injection that we are doing in terms of a vaccination program, that are outreaches, ensuring that there are vehicles that are taking those outreach teams to where the people are. But sometimes we have some stops and goes, as I said earlier on, but we have since again tried to increase the number of vehicles, because during the time when we thought we were off the woods in terms of the third wave. We thought let's focus now in particular on the vaccination. But with this now numbers rising, we must go do the contact tracing and all those things. So we must move with speed to be where people are. So we need more resources. So we are saying our people must assist us, because now with this Omicron, we need to be extra vigilant as people, because it is infecting in a way that is even double of what we have seen with other variants. And besides us saying we'll come and vaccinate, we'll do the contact tracing and all that, we need people to stick on the NPIs to make sure that they are protecting themselves not to be infected. But for now, as we speak, our hospitals have not yet experienced high numbers of the people who are being hospitalized. But the reality is that the numbers are rising of those who are infected. So that is a danger to our people.
Thank you very much, MEC. That is the MEC of Health Department here in the Eastern Cape, Mam Nomakhosazana Meth, outlining what exactly the province, where exactly is the province standing in terms of the positivity rate. She told us earlier that it's about 16% positivity rate here in the Eastern Cape. She is also saying that there are financial constraints as well as lack of resources, which are not that bad. But back to you in studio.